So I was told I have 15 minutes to discuss a topic that I could talk hours and hours about, so buckle up. So this is my fantastic team of functional medicine health coaches and clinicians. And of course, you already know I'm Dr. Amy Beard. I am a certified functional medicine doctor. I'm also family medicine boarded, a dietitian, and I have spent several hours in numerous ERs across our state, including my favorite one, St. Vincent Morrilton. Fantastic folks at that little ER. Love it. So let's get to it, shall we? So, I think we've got to start placing more importance on what we choose to put into our mouths. What we choose to eat or not to eat can have huge impacts on our health. And it really is this simple. You can either choose to harm yourself or help yourself by what you choose to put into your mouth. This is what food looks like. Isn't that beautiful? Looks like a nice spread back there. That looked like food to me. This is not food, okay? And in fact, it's not only is it not food, a lot of what is in this stuff is really bad for us. And in fact, there is now over 10,000 chemicals allowed in our foods and the containers for our food. Again, food, beautiful, unprocessed, unadulterated food. Not food, okay? You're starting to catch on here. There is nothing, absolutely nothing nutritious about anything in any of these products. Nothing. And in fact, this is what inflammation looks like. Inflammation in the form of additives, preservatives, food dyes, and tons of sugar. And unfortunately, I see this way too often in the hands of our children and a lot of our health professionals. Just saying. The quality of your food matters. You are what you eat. And I'm not sure how I play this clip. This is a clip, and I don't know that I'm going to be able to play it, but we have cows on our little farm in Perrin, Arkansas, and this was a clip of them eating grass and munching down. It was quite humorous to listen to them. But we raise 100% grass-fed, hormone-free, organic beef. And the grass-fed component is what really leads to that higher omega-3 fatty acid content that is so anti-inflammatory. These are good fats. So being grass-fed makes them, oh, is somebody going to play them? There we go. Oh, and now you can't hear it.
That's how it sounds like sometimes, too.
Oh, well. Okay. Moving on. Sorry about that. And this is a picture of my front yard that my husband let me turn into a raised bed garden. It is 100% organic, and we also try to use as many heirloom varieties as possible because they have a higher nutrient content and they taste so much better. We love our garden. This is some of the first fruits of our labor. Some radishes, tomatoes. The radishes are all gone, but the tomatoes are still coming on strong. Blueberries, some of my favorite. So glad we planted these. We are very, very heirloom tomato proud on my farm. We'd like to show them off whenever we can. And this is a picture of my niece helping us make marinara, because you got to do something with all those tomatoes. Anybody else having that problem right now? So many tomatoes. And we made marinara using ingredients from our garden. And my nephew was very disappointed to find out that Perrin does not have a sonic so that he could go get some cheese sticks for his marinara, because he knows Aunt Amy does not have cheese sticks in her refrigerator. And this is what really should be the focus when we are talking about our children's health and the health of society at large, the GI microbiome. I'm pretty sure a lot of you have already been hearing about this or have seen it while Googling. And, not only is most of the Western diet of limited benefit to our GI microbiome, a significant amount of it is detrimental to it. We are what we eat, and what we eat greatly impacts the bacteria that reside in our GI tract and their metabolic activities. And these metabolic activities can either have positive or negative impacts on our health. In fact, we have about 40 trillion bacteria residing within our GI microbiome, which is about 3 pounds in each of us. 40 trillion. We have more bacterial cells than we do human cells, by a factor of 10. You are more bacterial than you are human. So these trillions of bacteria that reside in our GI microbiome do some amazing things for our health. And we're finding out more and more every day just about what they're doing for us. They are modulating our immune system. They are helping us metabolize toxins. They make vitamins. They modulate the way our hormones work. They make short-chain fatty acids from the fiber that we eat if we're eating lots of fruits and vegetables that then go on to provide the major fuel source for our colon cells. They modulate our neurotransmitters, which affects our moods. There is a big correlation between what's going on in our GI tract and what's going on up here. They also help break down our food so that we can absorb the nutrients. And they're doing a lot of other things. This is just a very, very short list. This is the tip of the iceberg. Your GI tract is basically your immune system. 70% of your immune cells lie along your GI tract. That is amazing. So a diet of real food, unprocessed, is going to have beneficial impacts on your immune system. But a diet that is of highly processed foods primarily, lots of sugar, lots of inflammatory foods, is going to cause inflammation and immune dysfunction. So a bad diet often leads to a gut flora imbalance, or what we also call dysbiosis, which then often leads to gut permeability or a leaky gut. How many of you have heard of a leaky gut? Okay, good. And a leaky gut almost always leads to systemic inflammation. And this systemic inflammation can present itself in many, many different forms depending on the individual. We know of many disorders that are associated with this altered gut flora and a leaky gut. And this is just a short list, okay? And I want you to pay attention to how many of these disorders that are really not GI related, but they really are. Look at this: arthritis, ADD, fibromyalgia, obesity, kidney stones, hormonal issues. I mean, the list goes on and on and on. And I see this in my practice all day long. So now I'd like to present a case that shows you just how powerful food can be. This is Benson. Benson was 5 years old in this picture. And this was the first day that we saw Benson, and it happened to be the day that he was formally adopted by his stepmother, who is a school nurse in Fayetteville. And I'd like you to, his mother says that he appeared to be very anxious in this picture. And if you can notice, he's got these allergic shiners underneath his eyes. And he's kind of, he's a little on the thin side. Benson came to us suffering from chronic eczema, an itching that was so bad his mother had to wrap his arms at night so that he would not form excoriated lesions on them. He was also suffering from horrible anxiety. He could not stand to be around loud noises or large groups of people. He was very small for his age. He was at the 10th percentile on the growth chart. He suffered from chronic sinus and ear infections, which required multiple rounds of antibiotics. Again, something that is not very good for our microbiome, but is needed at times. And it also is associated with obesity. Children who take lots of antibiotics when they're young often go on to become obese adults. He was also sleepwalking and was never still when he was laying down to sleep. He had attention issues and had the diagnosis of ADD, but his parents did not want him on those medications. He had a language delay, which meant very poor school performance. And he also suffered from chronic rhinitis and congestion, which he took Zyrtec, Flonase, and Benadryl for. Benson's diet was horrible, like so many other of my patients that come to see me. And so was his microbiome. His microbiome was horrible as well. Benson loved sugar. He loved sugar, he loved junk food, he loved fried foods. Chocolate milk was one of his favorite things to drink. And it was very difficult for him to eat any vegetables. He just wanted no part of them. Although his stepmom tried her best to sneak them into some smoothies occasionally. This is basically what Benson's diet looked like, and the diet of his family. Doesn't look very healthy, does it? We did some testing on Benson, and the results were not surprising to me at all. He had horrible Candida yeast overgrowth in his GI tract due to primarily his high sugar intake. That'll do it every time. He also was suffering from multiple nutrient deficiencies of B vitamins, vitamin C, other antioxidants. He had imbalances of his neurotransmitters, and he had very low levels of omega-3 fatty acids. He didn't like fish or nuts or anything like that. He was just eating sugar and carbs. We also suspected that he might have a wheat or another food intolerance, even though his celiac panel came back negative. So our goal for Mr. Benson was to get his GI tract back on track. And first and foremost, what we did was we eliminated all the processed foods high in sugar. And then we had him start, initially taking probiotics twice a day, making sure he was taking a high-quality plant-based multivitamin. We had him on an omega-3 fatty acid supplement while we were trying to increase the foods that were high in omega-3s, because we really want the nutrients to come from foods, not supplements. But sometimes those are needed initially. But the goal is to get off the supplements as well and have our patients eating real food. We also increased his healthy fats, avocados, nut butters, eggs, olive oils. He did like those things. And his mom started sneaking in a lot more veggies in his smoothies and just offering more vegetables to him, because the more often you offer a vegetable or a new food to a child, the more likely they are to start eating it. And then we also had a policy of no electronics 2 hours before bed due to the blue light effects on your melatonin levels. And we ended up completely eliminating gluten and dairy from his diet because it was very obvious that he had an issue with those foods after we did an elimination and reintroduction diet. Here's Benson making breakfast with his siblings using some backyard eggs, olive oil, and gluten-free bread. In fact, children with behavioral issues such as ADD and we have a lot of those in our schools these days, are 7 times more likely to have a food intolerance. That's why we always rule out a food intolerance in our children with behavioral issues in my practice. So Mr. Benson was doing fantastic at his 3 and 6 month follow-ups. His eczema and itching completely gone. He was no longer needing Zyrtec or Benadryl, and he was no longer needing to be wrapped at night. He grew 3 sizes in 6 months. 3. He was no longer having ear and sinus infections, which meant no more antibiotics. Anxiety, gone. He could now hang out with large groups of people. His rhinitis and nasal congestion also were gone. No more Flonase. And he was no longer sleepwalking. And his mom said that he was getting up and looking well-rested and energized. He was a new kid. And his school performance changed greatly because his attention and language skills improved. This doesn't even look like the same kid. I mean, this kid grew like a weed once we made these changes. And we discovered the root causes of his issues. His mother says that his skin has never looked so beautiful since she's known him. And also notice that his allergic shiners, gone. I mean, this kid just looks so happy now. It makes me feel so good. This is a picture of his report card. Within 1 quarter, his performance improved. 1 quarter, and he was back on track. And not only did Benson's health improve, but his family's health improved too, because they also made the diet changes that were necessary. His stepmother no longer has adult acne, and her mom pooch, that's what she called it, not me, is gone. His sister no longer has eczema and anxiety, and another sister no longer needs Miralax for her constipation. This is one of my favorite slides, and I like to use it whenever I can because I am also one of those annoying people. I also have a gluten intolerance, but I did not figure it out until after most of my colon was removed. But better late than never. And there are, the words on this slide could not be more true. If there is one bit of advice that I could give you that could have huge impacts on the health of our children would be to limit or eliminate the processed food and the sugar in their diet. It's that important. Thank you.